Amanda Kundrod.
Oh, shucks. And let me just preface this presentation by saying that Helen told me that I was going to be sitting on this panel right here just answering questions. So here we are. She knows my love for public speaking is usually stuck in classrooms, so bear with me here. Okay, so good afternoon, everyone. It's such a pleasure to be here with so many colleagues who share the same passion for oral health advocacy. My name is Amanda Kundrod, as she said, and I serve as the Assistant Professor and Director of Clinical Services at Westmoreland County Community College. Today, I want to share a data-driven look at the dental hygiene pipeline, how applicant trends are changing, what challenges we're seeing in program capacity, and what that means for workforce sustainability and access to care. At Westmoreland, like many of your institutions, we're proud of the quality of our graduates, but we're also realistic about the barriers that prevent potential students from entering or completing our programs. This presentation takes a closer look at that story, both nationally and within Pennsylvania. So by the end of this session, I hope we'll walk away with a deeper understanding of these 4 key points. First, we'll describe current trends in dental hygiene applications, including where they're coming from and what the data say about our applicant quality. Next, we'll talk about acceptance rates and barriers, those often unseen factors that limit how many students actually make it into our classrooms. Then we'll look at challenges and opportunities in building a sustainable pipeline of hygienists, one that keeps pace with our workforce needs. And finally, we'll connect these trends to the broader issue of access to care, especially for underserved and rural regions of our state. For those of us in education, this is more than a numbers game. It's about ensuring that every community has access to skilled, compassionate, and oral health professionals. So let's start with the national perspective. This graph from the ADA Health Policy Institute shows first-year enrollment in allied health dental health programs from 2014 to 2024. What we see is that enrollment growth has been relatively flat, even as the population, oral health needs, and the demand for preventative care continues to rise. Dental hygiene programs have remained competitive, but the number of available seats hasn't increased proportionately. That means we're producing about the same number of graduates today as we had a decade ago, despite clear evidence that workforce shortages are worsening. It's not a lack of interest, it's a capacity problem. This next chart illustrates that imbalance more clearly. The maroon bars represent program capacity, how many students programs can accept, while the turquoise bars represent how many are actually enrolling. Many programs are running right at or near their capacity limits, while others leave seats unfilled due to faculty shortages, CODA accreditation constraints, or lack of clinical space. So while on paper it might look like we have room to grow, in reality, there are very real barriers to expansion. From an educator's standpoint, we know the challenge. It's not just about adding more seats, it's about having enough qualified faculty, clinical resources, and funding to maintain CODA standards while meeting student demands. When we talk about workforce shortages, we can't ignore the front-end barriers that students face just getting into dental hygiene programs. Applicants compete for limited seats, often needing very high GPAs and strong entrance scores. Many are also balancing jobs or family responsibilities while trying to complete rigorous prereq courses. Add in the financial costs, relocation needs, and long commute times, especially for rural students, and it's easy to see why some very capable individuals never even apply. These barriers don't just affect education, they directly impact the future dental hygiene workforce. So let's zoom in on Pennsylvania. We currently have 13 CODA accredited dental hygiene programs, but they're heavily concentrated in the southeastern urban areas of the state. That leaves major gaps in access to education, particularly in the northern and south central rural regions. For students in those areas, the nearest program might be hours away, and relocating isn't always feasible. This geographic imbalance not only limits who can pursue the profession, but it also contributes to workforce shortages in those same rural communities where care is most needed. We can't expect to fill those gaps in care if we don't first fill the gaps in educational opportunity. So now we'll highlight our program at Westmoreland County Community College. We're a rural, community-centered institution located about an hour east of Pittsburgh. Our dental hygiene program was established in 1994 with a maximum enrollment of 24 students per year. Like many of you, we work hard to provide high-quality clinical education with limited resources. Being in a rural setting, we serve a unique student population. Many are non-traditional learners or first-generation college students. Our graduates go on to work in practices and public health settings that directly serve their home communities, which is incredibly rewarding. But even with steady applicant interest, our ability to expand remains tied to clinical infrastructure. So looking at our application trends from 2005 through 2025, we've seen some interesting shifts. Applications peaked in the mid-2010s, dipped slightly during the pandemic, and have since rebounded. With significant lower tuition costs, community colleges play a vital role in reducing financial barriers and expanding access to dental hygiene education across diverse populations. This is one of the biggest reasons why our applicant pool is always significant. For example, an in-county student would pay $143 per credit, totaling about $16,900 for total tuition to become a licensed dental hygienist. While community college tuition remains affordable compared to university programs, these numbers are still daunting for many students, especially when factoring in lost wages during clinical semesters and the additional cost of supplies, instruments, and board exams. Traditionally, we focused on GPA and prerequisite completion with a grade of C or better, along with next scores. But what's notable is that the number of qualified applicants, those meeting GPA and prereq standards, has decreased slightly, even when overall applications have risen. This suggests that the pool is broadening, but not necessarily deepening in academic readiness. It's a reminder that recruitment alone is not enough. We also need stronger preparatory pathways to help students be ready to succeed once accepted. However, academic metrics alone do not always capture the whole picture. As you can see, even when we were accepting 24 students each year, we were graduating, on average, 19 students. This leads us to how our selective admissions process has evolved. We have found that incorporating candidate interviews allows us to identify who not only meet the academic standards, but also demonstrate persistence, strong communication skills, and professionalism. Our interview process helps us to see beyond the application and make sure great candidates aren't overlooked. As educators, we know the passion, professionalism, and resilience are often what carry students through the rigor of a dental hygiene program. When we track where our graduates go, the data reveal a clear pattern. Most hygienists remain near the suburban regions where they are trained. Once again, rural Pennsylvania, especially the northern tier and south central regions, continues to experience shortages. Without intentional efforts to train and retain hygienists in these communities, those access gaps are going to persist. This reinforces why location of education matters. Programs in rural regions often produce professionals who stay and serve there. So that leaves us to the heart of the issue, what we call the pipeline challenge. How do we sustain a flow from applicant to student to graduate and then to a practicing RDH? At each step, there are leak points. Students who can't afford to apply, who struggle to complete prereqs, or who graduate but can't find full-time employment with benefits. A sustainable pipeline requires us to think beyond admissions. It's about mentorship, employer partnerships, and long-term career support. It's not just about filling classrooms, it's ensuring that every accepted student successfully transitions into a thriving professional role. So how do we strengthen this pipeline? One key opportunity is expanding program capacity, and I plan to present this to my administrators at my community college. That means increasing the number of clinic chairs and lab space would be the next key step. In addition, recruiting and developing new faculty by mentoring our graduates, which we do, who are interested in teaching. We recognize the strengths and potential in our students and encourage them early on to pursue advanced degrees, empowering the next generation of educators and future members of our team. Partnerships are also essential for innovation. At Westmoreland, various programs such as nursing have found ways to share teaching and lab resources across remote campus locations. The dental programs have not had this opportunity, mostly due to costs associated with our trade. But the potential for growth is there. We continue to have strong transfer agreements with universities to support our BSDH completion, specifically with the University of Pittsburgh and Penn College of Technology. Lastly, working with local dental offices, health systems, and public health departments could potentially expand clinical experiences and help students see the reach of opportunities within the profession. We have to recognize that when we partner beyond our walls, we can serve more students and ultimately more patients. Another area of opportunity is developing alternative pathways. Hybrid and online learning models can reach working adults and students in remote regions who might not otherwise have access. Bridge programs create a natural progression point and support lifelong learning. At Westmoreland, we have a CDA to EFTA bridge program currently. Thinking outside the box to integrate the SIM technology and teledentistry into skill development, which has proven especially valuable for distance learners as well. But finally, rural recruitment models and scholarship incentives can make a tangible difference in where hygienists choose to practice. As we grow and innovate, maintaining professional integrity remains our foundation. Every change must align with licensure standards, code accreditation, and state board regs. As educators, our ultimate responsibility is to protect the public by ensuring that every graduate is competent, ethical, and prepared to provide safe, high-quality care. It's easy to get caught up in numbers and trends, but at the end of the day, our mission remains clear. Quality care is our commitment. Across the state, several models are already showing success, and I know I don't need to repeat. We've had a wonderful day of presenters, but I was overwhelmed with the information about regional training centers, bringing that education closer to rural students. I was so happy to get to hear the University of Pittsburgh of Dental Medicine speak about this opportunity for students. The rural dentistry tracks. I also love getting to hear Temple University's Kornberg School of Dentistry and piloting that specific rural dentistry track in Tamaqua. I would love to see that continue to happen. Pipeline programs, as we've spoken about, that identify and recruit students from rural backgrounds, offering scholarships, loan repayments. What great ideas. And lastly, I value community outreach as a vital part of our students' learning. Last weekend, actually just a couple days ago, 20 students and 5 faculty attended the Remote Area Medical Clinic, or RAM, in Butler, PA. The clinic registered 368 patients and provided over $280,000 in dental, vision, and medical services. During the event, our students had the opportunity to provide a variety of dental hygiene services, including prophies, fluoride application, gross debridement, perio-debridement, radiographic imaging. They also administered local anesthesia and assisted in both oral surgery and basic restorative procedures. The students and faculty worked very hard to serve the underserved. As their mentors, we are incredibly proud of their dedication to service and commitment to improving access to care. The students' compassion and enthusiasm for public health truly exemplify the values of our program. And if I would have had a little bit more time to turn in my slides, I would have put in a picture, because pictures are worth 1,000 words. And to see their smiles and to see our picture that we had at the end of the day, is just so noteworthy. So what's the big picture impact? When we strengthen the dental hygiene pipeline, we see more providers in underserved communities, increased access to preventative services, greater workforce diversity and flexibility, enhanced reach into rural populations, and a more sustainable oral health system overall. Expanding education doesn't just benefit students, it directly translates into healthier communities. So to wrap up, the future of our profession depends on how we respond to these trends. We have the data, we see the gaps, and we understand the barriers. Now it's up to us as educators, leaders, advocates to innovate within our programs and collaborate across the institutions to build the workforce our community needs. So thank you for your attention and enjoy the rest of your day. And I didn't give out my cell phone number, sorry. So just chat with me after.